Hi everyone, welcome to the webinar A World Without Skin Tears Day. My name is Pía Molina, speaking from Concepción, Chile. Today I will present a rather special case study for me. This particular case allows us to highlight certain care practices that extend beyond the acute phase of illness. Clinical observation and prevention remain the cornerstone of patient care, regardless of the technological research available in any hospital. The present case concerned a 28-year-old young man who sustained a motorcycle accident due to excessive speed. He lost control of the vehicle, fell, and the motorcycle landed on the top of him. His initial injuries include a fracture of the right arm and a thoracic contusion, without evidence of flayed chest. This young man has no significant past medical history. Surgical intervention was required for the reduction of the arm fracture. However, due to his thoracic contusion and the risk of a potential respiratory complication, he was admitted to the intensive care unit while awaiting surgery. Analgesic infusion was initiated through a peripheral vascular access in the left arm. The patient was positioned in an intensive care bed equipment with side rails, or equipped with side rails. As we know, the possible causes of skin tears are varied. Among them, the last three are particularly relevant to the presentation of this case: resin application and removal, patient transfer, and equipment-related injury. Why? Because our patient began experiencing pain at the site of the peripheral vascular access. Extravasation of the infusion was detected, leading to the removal of the venous access and the medical adhesive tape. This results in a MARSI. However, complication continued with lowering the bed rail. First, a skin injury caused by the rail itself was observed, and the act of lowering the rail produced an additional skin tear. In this image, we can observe the extravasation on the intravenous infusion with swelling of the arm, but without local heat or phlebitis, as well as a second lesion occurring above the removal of the medical tape, a MARSI. This image illustrates the device-related injury, showing the imprint of the bed rail, along with the skin tear located in the lower third of the lesion. This general image, despite the bed rail of the unit, will leave a visible mark of the patient's skin. Faced with the variety of lesions, the first step is to recognize that all of them are preventable and they are directly associated with care in the hospital environment. The first injury, MARSI, is an adhesive-related lesion that can be classified as a type 3 skin tear. The second, the skin tear caused by the bed rail, corresponds to a type 2 skin tear with partial flap loss. But what we do? First, we control the bleeding. The bleeding from the bed rail injury was minimal and required only brief compression for the hemostasis. The wound was cleansed with normal saline, and then we applied the hypochlorous acid. Next, the lesion was classified as a type 2 skin tear with partial flap loss. A skin barrier spray was applied to the perilesional area. After that, a silicone dressing was placed, covered with a wooden gauze as a secondary dressing, and secured with a gauze bandage. On the same day, the patient underwent arm surgery, although we lost follow-up and do not know the exact progression of his injuries. But as a team, we established a new care guidelines. What are our reflections and lessons learned? The importance of the continuous monitoring of the skin under all circumstances. Prevention of any type of skin injury in immobilized patients. Critical role of health professionals in the early detection and management of complications. And relevance of the skin protection techniques and appropriate dressing selection. With respect to the clinical case, the most significant points are timely intervention preventing further complications, highlight the need of prevention protocols and ongoing staff training. So finally, don't forget that you can visit our website, ISTAP.org, to explore all the available tools for assessment of skin tears, which can support your daily practice. Thank you very much for your attention and see you soon.